And welcome back to the XL Energy Center. I'm now joined by Dr. Caitlin Chambers from TRIA. And you guys are big sponsors here, but you work specifically with women athletes, and that's becoming more and more common. Tell me about that.
Yeah, so I'm a part of the Women's Sports Medicine program at TRIA, which is based out of TRIA Woodbury. And the reason that we really took a special interest in this is that while men and women play similar sports, they do so differently. So their bodies handle it differently. They have different anatomy, different biomechanics, even hormonal differences that put women at an increased risk for certain injuries as compared to men.
What are some of the common injuries that women athletes have, hockey players in particular?
Yeah, so in hockey, one of the common problems is hip problems. So that can be strains of the tendons and muscles around the groin, such as the hip flexors, the adductors, but also the hip joint itself. That powerful push-off that hockey players have to accelerate rapidly puts this hip in a position where it can impinge with the ball against the socket, and that can damage the labrum and the cartilage between the two.
I know that at TRIA, you not only fix, but you also try to prevent injuries. So how can young ladies prevent these injuries?
I would say the answer to that is twofold. I think for these young athletes, a focused strength and conditioning program is really key to making sure there's no big strength imbalances that can put them prone to injury. And secondly, really making sure that they have good off-season cross-training. So playing other sports is really key to keeping these girls healthy in the long term.
All right, Dr. Chambers, thanks so much, and thanks TRIA for help sponsoring the Minnesota State High School tournaments.